All right. Hello and good evening. Welcome to Facebook. I'm sitting down with Jessie B from rural Georgia. She is a mom, a nurse, and the founder of Safe Living Access, a mobile harm reduction program. Jessie B, thanks for joining. We were just having a conversation about how we want this to be raw and open and honest, and we're not afraid for people to ask hard questions because we want to understand more about harm reduction. So thanks for that, and thanks for being here.
Thank y'all for having me. I was really honored to be asked. Harm reductions, it's hard to understand, and I don't know that I can really help a whole lot, but I can certainly give my perspective on it, and maybe it'll help somebody for sure.
Yep, experience, strength, and hope, right? I've heard that somewhere. Okay, well, can you start by telling me a little bit about yourself and about what kind of led you to harm reduction?
Well, I'm a nurse. I've been a nurse over 20 years, and working in the ER and working in a correctional facility. And I do live in Southwest Georgia, and I have a daughter. I have the most amazingly wonderful daughter. Her name is Kate. We call her KB. And KB, raised here with me and her dad, and go to school, and we're very involved in the church and just all the things. Things happen. She went through some teenage trauma, and gave birth to the most beautiful baby boy when she was 16. Pain comes in so many different ways. For her, it was emotional and spiritual, in the form of shame. And no matter what we offered or what we did or how because we supported, babies are blessings no matter where they come from. So it's okay. She couldn't work through it. And at 18, she met a young man, and he told her that he had something that would help her pain. And it was in a syringe. So he helped her with her first IV dose of a street opiate. And she said that it was like a hug from me, the most pure, genuine, most loving, and all those bad things, all those bad thoughts that she had about herself went away. And that was the only thing that she had found since she got pregnant when she was 15 that made her stop hurting. And so no matter what we did, how we tried to help her, nothing could ever top that. So that's where this began.
And so you're a mom, you're dealing with supporting your daughter through trauma and then through sort of drug use as a response to her trauma, it sounds like. That's difficult for you, no doubt. We know, addiction's a family disease, affects families. So what's that like for you?
It was just, at the time, I'm still just mama, and I'm still a nurse. And thinking back to the way I thought about things then, she wasn't raised this way. She's got good parents. We're in the church. We do this and we do all the things. You weren't raised this way. You're gonna get your butt back to this house. You're gonna stop these drugs. We're gonna get you back in school. We're gonna blah, 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 blah. And the more I said what she was gonna do, the harder she ran from me. Now, we had custody of the baby. So here me and my husband are chasing her, trying to raise the baby, trying to hold down our jobs, trying to keep our marriage together, trying to do all the things. It became impossible. And every day, Kaylin was compounded by her shame and by her pain, her emotional pain. She had so many people reaching out to her to support her. Kaylin, we still love you. Her real name's Kaylin. She goes by KB on the street. You know, Kaylin, we still love you. Kaylin, we're here for you. Kaylin, we want to help you. Her shame, the stigma behind being a junkie, she would look at herself and say, y'all can't love me like you did, not anymore, not now. So that's where we were.
You said something I thought was interesting, something to the, I'm not sure I got this exactly right, but something like the more I said what she needed to do, the more she ran away from me. So kind of along those lines, how did you first kind of come to harm reduction?
We fought. She and I had a real bad fight in the Krispy Kreme parking lot one morning on the way to work. I would leave for work an hour early every morning. I would ride the streets where I knew she typically would be. I'd ride an hour before work. I'd ride an hour and a half at lunch. And I'd ride an hour every afternoon. So I would spend 3.5 hours every weekday riding and looking for her. And I saw her one morning. And I flew across a bunch of lanes of traffic, and I flew up in the Krispy Kreme parking lot, and I jumped out and I ran up on her too fast, and we fought. We fought. Because I was born in Kentucky, and I grew up around Clarksville and Madisonville and Chattanooga, and now I'm down here in Southwest Georgia. And you swing on one of us, we're gonna swing back. and she stood up. Me and her both stood up. And she threw her hands out real big. And she said, Mama, what the F do you want from me? I slung my hands out too. And I said, if you could just not die, that would be great. And that's when it hit me. Just don't die. Just don't die. Because if you're dead, nothing will ever happen. You won't have the chance to stay where you're at. You won't have the chance to do anything different, even if you want to one day, right? I'd been trying to make her. She got arrested. I left her in jail. I didn't bail her out. I left her sitting there 7 days. Drug court got her out. I didn't even want them to do that. That's not right. Now, I was happy at the time that she was in jail because I knew where she was. It was selfish on me. Well, if she's in jail, I know she's safe. There's far more drugs in that jail than we want to think. And I knew that. I was a jail nurse. I worked there it's a 1,200 bed maximum security facility. I worked there for 3 years. Why did my dumb behind think that she couldn't get what she needed in there? But I knew where she was. Oh, I know where she's at. I know where she's at. She was better off on the street. So I left her in jail. Drug court. She went to sober living. She went to rehab. She went to detox. She went to rehab. She went to rehab. We put her here. We put her there. That didn't work. This didn't work. Sober living. She had to do AA or NA. She was going to 3 meetings a day, until she got a job. And then once she got a job, she had to go to, 4 meetings a day. Everything was just, you're going to, and you're going to do it this way. And there's no wiggle room. It doesn't matter if this doesn't feel right, if it doesn't feel good. This is what you're going to do. Not everybody starts using substances for the same reason. It stands to reason that not everyone's going to be able to stop using substances the same way. I didn't know that. I was doing the best I could with what I had at the time. And every time we mandated she do something and she failed because it wasn't what she needed. Yeah, she needed help. Yes, yes. But it wasn't the kind of help she needed. I was like sending her to a foot doctor for a toothache. Yeah, it's a doctor and it fixes things. But not this. So the more I chased her and the more I tried to help her and the more I kept, well, you're doing everything you can. I was doing everything I could. But one thing, I wasn't asking her, what do you need? And what are your goals? What do you want to do? There's people out there that don't want to change. We have to accept that we've got free will. But the more I chased and mandated, the more she ran and hid. Every time she failed, the more shame compounded, stigma, grief. And it reached a point to where she wouldn't talk to me at all. I'd go weeks and weeks and weeks without hearing from my baby, and she's my only baby. I wanted one girl, and I had one girl. I'd go 3 and 4 weeks without hearing from her, and I knew that had to stop. And it took me figuring out that I was the problem. She wasn't hearing from me because every time she did hear from me, I was telling her what I wanted her to do, and I was telling her how she was going to do it. And I was setting her up for failure.
So I don't want to put words in your mouth, but please tell me if I'm getting this right. It sounds to me like harm reduction allowed you to support your daughter for the first time through that in a meaningful way, because where you tried to support her by pushing her in the direction of any other help, she was experiencing it as like force, like she's being coerced into doing something, and then she's pushing back. Have I got that right?
That is exactly right. You said in 5 seconds what I said in 15 minutes. You are exactly right. So if you could not die, that would be great. Now, the part that I haven't shared with y'all yet is that she has had 11 incidences where she has gone into respiratory depression, respiratory distress due to a substance that she was using. So 11 times she's nearly stopped breathing. 3 of those 11, so 8 she nearly stopped. 3 required significant respiratory support. Like she was about 45 seconds from being unable to be reversed. Those 3 times. As I've been a nurse in the ER a long time, I know the paramedics, and the first time she went down, I got a call, and they said, I know I'm not supposed to tell you this, but if this was my baby and you didn't tell me, I don't know how I would feel. So don't die. All right. So how do we not die? Because all this other stuff ain't working. Mm-hmm. Don't die. Narcan, right? The overdose stuff, the stuff. Okay. All right. So don't die. I'm gonna get some Narcan, because that seems to be what we're doing here. We're overdosing. It's really drug poisoning, but we can talk about that a whole nother time. You're getting too much of something in your system, you don't know what it is. And if you don't know what you're taking, you don't know how much to take. And if you think you're taking this, but you're taking that, it's a whole mess. So I start trying to find Narcan. I can get it on my insurance. I'm a teacher. At the time I was teaching for the school system. I can get a box of Narcan, which is 2 sprays, every 180 days. Now she's had 11 of these events, 3 of them that dang near took her out, and I can't get but a box, 2 sprays every 8. So what am I supposed to do? So I'm like, all right, baby, I'm gonna need you to 6 months now. Be good. Oh, that is And what about all her homies that's around her?
Mhm.
So I start reaching out to my teacher friends. I'm like, yo, y'all got Narcan. Y'all know what, y'all don't know what it is, but look, your insurance is covering it. We've already paid for it out of our premiums. Can I have your Narcan? They're all like, no, I'm not doing that. I'm not putting Narcan on my med profile and people think that I use drugs. Well, it doesn't work that way, but all right. So I started Googling and found the Georgia Overdose Prevention. So the Georgia Overdose Prevention is out of Atlanta. They get a grant every year for a whole bunch of Narcan, and so I called the lady and I'm like, hey lady, I need some Narcan. She said, we need a Narcan distributor in your area. Would you be interested? I said, well, what does it mean? She said, it means you get access to, this family donates all this money every year for us to buy Narcan, and you get as much of it as you want. Sign me up. This is exactly what I need. Yep. Yes. She starts sending me Narcan. I thought, I got this. See, I got it now. Now I got it. Don't die. I got the Narcan. I'm winning. Mm-hmm. So I start giving Kaylin Narcan. Kaylin, I'm training them. I'm teaching them how to do everything, all the things, the breathing and all this and all that. All our homies are starting to get Narcan. I started noticing. Now, this, some of y'all don't know. I don't even know who's here. How y'all here. Y'all just hear me out, because me getting to where I'm at now, it wasn't overnight. And it's still, sometimes I look in the mirror and I think, what the hell are you doing? Just know it's not easy to get to where I'm at.
Jessie, when you say get to where you're at, you mean in terms of your journey with harm reduction? Yeah.
I didn't start here. I didn't start here at all. I started looking at their arms. Y'all know I'm a nurse. I'm a RN. I got some other bunch of letters, some more letters behind my name. Don't matter. But I've been a nurse a long time, and I know a wound when I see it. I said, what is wrong with y'all's raggedy arms? They can't get clean injection supplies. What do you mean? Yes, you could. They're legal. You can go to the Walmarts and buy them. You can, but it's at the pharmacist's discretion. If the pharmacist thinks you're doing foolery with them, they don't have to sell them to you. Now, here's where it gets hard, y'all. Someone in the throes of a substance use disorder, someone battling with what's known as addiction, that is a sick like I have never seen when you start withdrawing. It is a hell that brings people to their knees. And many of us know, I know I accidentally got dependent on pills after a surgery in 2003. Mine were prescription. I like to die. I thought I did. I didn't, but it was awful. It was awful. They will reuse needles. They'll sharpen them on matchbooks, bricks. They'll wash them with bleach. They will do what they have to do to not hurt physically, psychologically, emotionally, spiritually. They will do what they have to do. They are going to use their substance, whether they have the right equipment or not. And I'm looking at my baby's arms, and I know I have forced her into every rehab and every facility, and we have drained our savings, and I've got custody of her baby, and I'm like, okay. So I go to Amazon and I order some syringes. And my hands shook when I gave them out, and I cried and I vomited. I got around the corner and I threw up. because I'm enabling, right? She wouldn't be doing that if I wouldn't giving her those needles. Yes, she would. Yes, she would. So I said, well, if it's a mistake, I can stop, right? I haven't committed to doing this forever. All I know is what we're doing ain't working. Got to do something else. So then I find out that they need other. What else do you need? You need what? You need. So they start telling me all the stuff that they're in or what they're using, and I'm like, ew, no, y'all got some alcohol pads? No. Okay, all right. Well, then I find out that there's a huge community of sex workers here, and that's fine. People, you do what you do. But y'all got things that you need, right? You got condoms and lube and dental dams. No. So when y'all don't have those things, y'all are. Okay. All right. So I go to the health department. I'm like, y'all know we got a whole bunch of people out here. They're like, yeah. We got all the stuff here, Jessie. We got so much stuff. They don't come get it? Nope. Well, of course they don't. Jessie, stupid. Look where the health department's at. It's an amazing facility with the most amazing people and the most amazing stuff. It is all the way at the south end of the county. We have city buses. They run like twice a week, maybe. Like, I don't know what time they run. 2:30 in the morning. I don't know what time they run. I don't ever see them run. There is no restaurants down by the health department. There's no hotels down by the health department. There's no nothing by the health department. How are you supposed to get down there? I live in Southwest Georgia. In the summer, it's 104 with like an 89% humidity. You can't walk down there. You die. Mm. So I said, well, can I get some of this stuff and take it to the people? They're like, oh, you want to do that? And I'm like, well, I mean, I want to do something. Can we? Y'all got all this stuff, right? Yeah. They start giving me all the stuff. I start taking all the stuff to the people. So we're getting them hooked up now. I'm noticing their arms aren't looking quite as raggedy, which is good. Not hearing about as many people dying. They're still dying though. Drug poisonings. And then as I'm out there, I start having people come up to me and, hey, we use our drugs differently. We don't inject, but we smoke them. You smoke them? How the hell you smoke? What are you smoking? How does that work? They tell me. And I'm like, they'll have sores on their faces and their mouths and their, and poor dentation because they get it's meth mouth is not from methamphetamine. Meth mouth is from dehydration. Their mouths get so dry that it's dehydration. Okay. And the fact that they can't find their toothbrushes. So I'm like, okay, all right, we got some raggedy mouths going on. We need to do something about that. Okay. So I live in Albany, Georgia. If you look up Albany, Georgia, COVID, and Phoebe, like the girl, Phoebe, Putney, Putney. We are the town in the United States. We are the town in the continental United States that kicked off COVID in March of 2020. I don't know what year it was, 2020. We're the town that had all the funerals where all the people died. We had mobile morgues for weeks. So about the time that I'm noticing these raggedy mouths and these busted up arms and these poor sex workers that ain't got nothing to work with, COVID hit. Y'all cannot be spreading COVID, sharing all these, what are they? Stems, pipes, straights, what? I don't know. Y'all can't, because y'all are going to keep doing what you're doing. Y'all have already proved that. So I made contact with an organization who was like, we got you, Jessie. And they started sending me stuff. What started out as one person, my baby, became my baby and her couple handful of homies. became an entire town.
Mhm.
So I founded a little organization called 229, that's our area code, 229 Safer Living Access. So it's called 229 SLA. And I load up my Jeep with all the things that people have told me they need to stay healthy and to stay alive. So I'm just out there just giving them all the stuff, right? Yeah, I am. But since December of 2020, that's when I officially founded this organization. So that's what, 14 months. I've had 14. This week was 14. 14 participants have come to me and said, I'm tired of this life. I want to do something different. I trust you. Will you help me? So 14 of my participants are in abstinence now. If they have children, they've gotten visitation back with their children. They are all but 4, so 10 of them are enrolled in technical college right now, getting their GEDs if they need those, and getting a certification in welding or cosmetology or something like that. I work at the technical college too, so I'm able to take those participants straight to the college, and no stigma, no shame, low barrier access, get them enrolled. They ask about HIV testing and STD testing. I'm able to do HIV testing. I do it out of my Jeep. I do mobile HIV testing. We do linkage to care. I make sure they get to their appointments if they need them. I think one of the biggest things though is last month, the director of EMS called me, Sam. And he said, Jessie, I want to let you know that our numbers came in for 2020 or 2021. He said, last year we had 100 less EMS calls for drug-related incidences than the year before. He said, we had 10 fewer drug-related deaths than we had the year before. He said, and we really think that that's directly proportionate to what you're doing.
Nice job.
So, harm reduction means I do the things that when I go to bed at night and I lay my head down, should my baby's chapter end tonight, I know that I supported her and loved her the way she needed me to. She knows she's loved with limits, with boundaries. Please don't think that I won't cuss her out and hang up on her in the drop of a hat. But I know that I met her and everybody else. I met them where they were. I offered them what they said they needed to stay healthy and stay alive. Period. A lot of people like to say harm reduction is about keeping people healthy and alive until they can stop. If stopping is their goal, then that's great. Then we do keep them healthy and alive until they can stop. Otherwise, we just keep them healthy and alive, because some people can't see to the end of the road yet. Some people don't know what they want to do. They just don't want to die. And we can do that. We can help. That's what harm reduction is for me. Harm reduction gave me back a relationship with my daughter. She calls me. She tells me she loves me. I get to take her to doctor's appointments and dental appointments. She comes home and spends the night with us, eats supper with us sometimes. I didn't have that for a long time because she trusts me now to not force what I think is best for her on her.
Jessie, what's that like to sit down at dinner with your daughter, who you know is in active use and you have concerns for her safety, but also you know that because of your approach, you have a relationship with her and she's sitting down for dinner with you when she otherwise wouldn't be? Just what are the feelings that you're feeling? What's it like?
If you really want to, if you really, really, really want to get down to the brass tacks, Alex, we're all born dying. I could leave here and go to the store and pull out in front of a semi and be a goner. I don't focus on that. I focus on the here and now. And any of us could be gone in a second. But in that moment, she's here and she's with us and she's happy and she's smiling and she's eating and she's safe and she's warm. And something that I haven't really put out there, I think I hate to jinx it, but I'm going to tell it. She hasn't used an IV opiate in 4 months. And I didn't do a damn thing to help that. She came there on her own.
With the loving support of her mother.
But it was her decision in her time. And I don't know that she would have come to that decision without love and acceptance.
Mm-hmm. That's pretty beautiful. I want to pivot here a little bit. In your mobile and in your outreach work, you're not only working with people who use drugs, but in some cases you're doing some harm reduction outreach with people who sell drugs. And that may be something that's entirely new to some folks who may be listening. So can you talk a little bit about how you came to that and what that's like?
That's a story. So the first time Kaylin stopped breathing, the first time she suffered a drug poisoning or overdose, like I said, we're not going to get into the semantics of that. The first time she experienced a drug poisoning, I was mad. I was mad. I'm going to go find that drug dealer because I'm a mama. I'm a mama from Tennessee. You watch and see what I'm finna do. I figured out who it was. I got the dealer's name. I figured out where she lived. What did I do? I went to her house. I went to her house. Don't do this. Everything that I'm about to tell you is an absolutely do not do. Please do not do this. It's a wonder that y'all ever even know that I existed, because it could have been past tense a long time ago. I go to this person's house. And what do? You pull up. I pull up and I'm like, this is not somewhere I should be. But here we are. I get out. I get my bag like an idiot. Bam, 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 on the door. Don't do this. The door opened. I recognized the person opening the door. I called her name, the name that I knew her by. She said, Jessie? I said, she looked, she said, get in. She snatched me and slammed the door. Locks. Pow, 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 pow. She hugged me. I hugged her back. I love her. I worked with her. I worked with her at a facility once upon a time. She worked in environmental services and she was my favorite. She was assigned to my pod often when I worked in the ER at this facility. Loved her. Loved her. I still love her. She said, come in. Okay. I sat down at the kitchen table. She said, well, you want something to drink? You eat a glass of tea? Sure. Don't drink. tea in a drug dealer's house, y'all. Don't do that. Don't do that. Don't do that. But I did. I sat there and we're talking. And she's telling me about her mom and them, and I'm telling her about. And she said, Jessie, why are you here? I said, I'm looking for so and so. I said the street name of the person that I was looking for. She bristled a little bit. She kind of sat up a little bit. She said, that's me. That's you? I took another swig of tea. I wished it had rat poison at that time in it because I just wanted to just fall through the floor. I said, I'm KB's mama. And she hung her head and cried. So there I was, sitting across from the person who sold my baby a substance that made her go into respiratory failure. I knew this woman. I knew her mama. I knew her children. What am I going to do? She didn't want to hurt my baby. She didn't want to hurt my baby. That woman would have never hurt me for nothing in this world. She was my friend. I know when her birth date is. I'm looking at her and she's looking at me. We crying. She's a mama too. She's just trying to make enough money to take care of her two children. They stay with her mama. Of course, she don't have them around this that she's doing. They stay with her mama. I said, if she wasn't buying it from you, who would she be buying it from? She gave me a name. I said, will you call him? She said, yeah. She said, and tell him what? Tell him I'm on the way. Tell him I'm on the way. She said, you can't do that. Bet I did it here. She calls him. She's all right. That's where they at. She told me. I went. Bam, 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 bam. Same thing. Over and over and over for 3 weeks. I did not have any idea what I was doing. I had no idea how dangerous what I was doing. It truly is a miracle that y'all met me. When I got to the last house, I bang, bang, banged on the door. The person opened the door. He glared down at me and he said, I'm just gonna say what he said. He said, I've been waiting on your fucking ass. And he grabbed me by the shirt and threw me in the door and slammed it. Thankfully, he was kind. It took me 3.5 weeks to go to every, I guess places where you go buy drugs are called different things in different places. Here, they're called trap houses. That's what they're called here. It took me 3.5 weeks to go to every trap in my town. And unbeknownst to me, I met every gang leader in this town. Not everybody in this town looks like me. My town is 77% Black, not BIPOC, not Black, brown, indigenous, Black. Okay. 41% are at or below of our people here are at or below the federal poverty limit. We have a very, very heavy gang presence, many different gangs. I met them all. And I found out I knew a lot of them from the ER, from working at the jail. I'd already met some of them. That's where it started. That's where I learned. Yeah, you know, you can take down the little low-level drug dealers. We could pick them off. I could have turned all them in. I could have. They just little worker bees. Pick that one off. There's 3 more standing in line to take its place. You haven't done nothing. You haven't done a thing. What wound up happening was about a week and a half later, nobody would sell Kaylin anything because they'd met her crazy mama. And what nobody sell to her. That's a good thing, right? That's an awful thing. And let me tell you why. She's going to find her substance because she's sick and she's hurting. By me taking away the people that she knew she could trust to keep her as safe as she could be, I forced her to go to people that she had never met, had never known, had not developed any type of relationship with, did not know her, did not care who her mama was, did not give 2 damns about her. I already took something that was on the scale of a 7 danger and I made it a 9. So then I had to go back. And we had to talk some more. So how does that carry on now today? It's been some years. So what do I do now? A lot of those dealers don't deal anymore. For one, they've grown up, they've moved on, they've decided they want to do better things, different things, safer things, healthier things. A lot of them no longer sell opiates. They might sell a little weed every now and then. Weeds, marijuana is still illegal here, but they might sell a little weed. Sell it. I don't care. Sell the weed. I don't care. Some of them still sell some opiate. Some of them still sell some methamphetamine. They call me. They want to know if something's safe. They want to know how to test it. How do you test this? Do you have any of those strips that I could give to people? Can I show them how? Can you leave some Narcan here so that I can give it to people when they come? Can you leave some clean rigs here so I can give them to people when they come? Because it's just the right thing to do. I mean, yeah, if you're going to do this, then can you just do it better? So that's the relationship that I have with a lot of the drug dealers here.
That's a pretty interesting and unique dynamic, I would think.
I can't beat them. I'm not joining them. But if you're going to drive your car 100 miles an hour, I want you to please make sure your tires are good and intact, and I want you to please wear your seatbelt.
Yeah, let's at least reduce the harm. Let me jump in here real quick just to remind folks they can chime in with questions on Facebook as we go. We had a question pre-submitted about alcohol, about harm reduction for alcohol. So we've talked quite a bit about harm reduction for IV drug use and also for people who smoke drugs. But what about for people who drink? What would harm reduction look like in that context?
Well, it would depend on what the harm is. What's the harm? First off, the person has to say, alcohol's causing me harm by what? And that's where you start. I don't want to stop drinking alcohol, but I do what? I drink too much. All right. So well, tell us about that. How is it that you drink too much? How are you drinking? Where are you drinking? What's the deal? What of that can you change? What are some things that you're doing that you could do less of, that you could do less frequently, that you could, I'm just saying, if somebody said, I drink 4 liquor drinks every night before bed. Okay. So what's your harm? I wake up in the morning and I feel terrible. I feel just terrible. I expect you do. That has as much to do with you being dehydrated as anything.
Mm-hmm.
So what if in between every one of them liquor drinks, we drank us a bottle of water?
Mm-hmm.
How about that? Oh, I can do that. I can do that. You get your first drink, but to reward yourself with the second one, you got to drink your bottle of water. I can do that. Well, what'll happen is they'll drink that liquor drink, then they'll drink that bottle of water, and then they'll drink that liquor drink, and they'll drink that bottle of water, and it's taking them as much time to drink 2 liquor drinks and 2 bottles of water as it would have taken them to drink 4 liquor drinks, and their belly's full.
Mm-hmm. Mm-hmm. It's kind of
So
simple, practical.
They've drank 2 less drinks, and they're hydrated.
Yeah.
Harm reduction is about you allowing the person to identify the harm. Mm-hmm. What are you doing that you don't like? We'll see if we can find a workaround.
Jessie, I've got a difficult question for you. Someone wrote in and told us that they tried using a harm reduction approach with their child, and unfortunately they lost their son to an overdose. And they've asked, how do we know what is the right path to choose?
We don't. We don't. And I'm so sorry. We don't know the right path. We ask the person what they need. We try to meet them where they are. We make them feel as loved and appreciated as they are. And that's it. I read a story one time where this man, he said that he had been working with parents whose children suffer with substance use disorder. He worked with parents who practiced tough love. And he worked with parents who took more of an approach as what I do. And he polled both groups, both the harm reduction technique parents and the tough love parents. Both had lost children. So he polled them, and everything was exactly the same up until one part. There was one piece that was different. The parents that practiced tough love and lost their children had a lot of questions. They had a lot of things that they didn't know the answers to that they wished they did. The parents that practiced more of a harm reduction technique had less questions. They had a lot of times their child was with them, maybe in the home, or they knew exactly where they were, where to look for them. I hope that music's not too loud. Can y'all hear that? Is it too loud?
No.
Go ahead and cuss them out. They knew, where some of the ones that practiced the more tough love had more harder questions. If I have the chance of an outcome being the same, I'm going to try to do it more of a harm reduction way. we don't know if what we're doing is right. I'd never, ever, ever judge a parent for tough love. I tried tough love in the beginning. I was all for it.
Mhm.
If it had worked, none of this would be.
Mhm.
But it didn't. The more I practiced tough love, the closer she got to leaving me. We don't know.
So as sort of a follow-up, another question that's come in, someone's asked, I wonder sometimes if I should give my kid money. What do you think? Is it enabling? I don't want my baby to be hungry or to be cold.
I give my baby money. How about that? I do. But she has an allowance, and I'm not going to say how much it is because she might hear it, and I don't want her to hear it. But I give her an allowance, and she says, Mama, I need $20. Okay. I send it. Mama, I need 10. Okay. I send it. I send it until she reaches her allowance, her limit. And if it takes her all month to reach it, fine. If she goes through it the first week, that's okay too. Because at that point I say, sorry, baby, I don't have any more to give you this month. I'm sorry. I've done all I can do this month. Because now them things is slick, ain't they? They'll tell us parents some stuff and make us think that they're just in the direst of straits. Mama, if you don't send me $35 for my room right now, we're going to get put out. We're going to have to sleep in the cold. Okay, first off, I'm in Southwest Georgia and it was 82 degrees today. Hey. All right. Now, you might be a little cool, but you ain't going to freeze to death. All right. That's A. B, she's got a home. I'm sitting in it. Get put out. I don't know about them other people, but I'll come get you.
Yeah.
No, I'm not going to send you $35 to pay for a room when you got a room here in this house that I'm sitting in. You need me to come get you? No, I'll figure it out. All right. Well, you need me to come get you. Let me know. Love you. She hangs up on me. Hungry. I don't want my baby to be hungry either, right? I don't. Our children are not starving to death. They're really not. They're really not. They tell us they are, but they're not. Mom, I'm so hungry. I tell her, I say, you are in luck. I cooked the most amazing supper last night. You want me to go fix you a plate and bring it to you? You want me to pick you up and you'll come out here and eat with us? Well, and at McDonald's, can't you just send me the money? Oh, I got pot roast and stuff in here. What? No. You want me to fix you a plate? Or you want me to come get you? Oh, you gonna figure it out? All right. I love you.
I love that your harm reduction comes from a very practical place.
Yeah, because they'll drive you crazy. People who have substance use disorder, they've got to meet their needs. Okay, we've all got the Maslow's triangle. Everybody's got the triangle, and the crap in the bottom we got to meet before we get all the way to the top. Self-actualization, whatever that means. Everybody's base of the triangle looks different, right? Mm-hmm. For someone suffering substance use disorder, someone with an active addiction and active use, the substance is in the bottom of the triangle, right? Yep. So I acknowledge that and I accept that, but I can't keep lighting myself on fire to make other people warm. And I'm not going to put myself out of the way and inconvenience myself and make myself go broke. I work a full-time job to pay for the home that she chooses to not live in, which is fine because I got to live here too, and her daddy and her dogs and her cats and all that crap. Mm-hmm. But I work a part-time job that pays for harm reduction. This money, the stuff that I buy doesn't come out of anything but my pocket. Mm-hmm. I pay for this stuff. And that's kind of how I look at it. I'm like, now look, I keep a house. I keep food in the refrigerator. I keep food cooked. I work a full-time job. I work a part-time job to buy you little raggedy rascals the stuff that y'all need to stay healthy and alive. No, I'm not buying you a cheeseburger. No, to hell with that. No, I'm not paying $35 for a room. You got a room. When she reaches out to me, I ask her, Mama, I look at the text message and I go, oh, here we go. Mommy, girl, you are 22. Shut up. Mommy. I say, ma'am, I need to ask you a question. I said, do you need to ask your mother a question, or do you need to ask a harm reductionist a question? And it's usually her mama. I need to talk to my mommy. What do you want? So I can go on and tell you no, make you mad, and get it over with.
Yeah.
Our children, our loved ones are so resilient. They really are.
Yeah.
They really are. And that's what I told her. I said, baby, you can figure out how to get anything else in the world that you need. It's amazing how you can find the stuff that you need, but then your life falls apart when you can't afford a hamburger. Yeah.
Well, kind of, you sort of answered this in talking about how living with or loving someone with a substance use disorder can effectively drive you crazy. But someone's asked, do you ever worry or second guess? I try to take this approach with my son, but sometimes I still worry I'm making a mistake.
Oh, do I worry that I'm making a mistake? Yeah. I'm worrying right now. Probably. Yeah. It's all a mistake. It's, if people aren't communicating with you clearly what their needs are, and they leaving you out here to kind of guess and fake the funk to get it right, yeah, we're gonna screw it up. Yeah. But I look at it like this. I asked you to tell me what you needed, how I could support you, what we could do, and you don't answer me. You leave me out here in the dark to figure it out for my own. So I screwed it up. However, I really just did the best I could with what I had at the time, which wasn't a whole lot. So if you don't want me to keep screwing up for you like this, I'm gonna need you to come work with me some. And that's just really how I address it. I mean, like, and I don't have a problem saying no. I did in the beginning, because I tell you, I had such a problem in the beginning telling her no, because when I'd started kind of getting the relationship back, I'd make her mad and she'd punish me by not talking to me. Right. And that's the worst. That's the worst. But see, I know her little trick now. I already know. Oh, I'm not. You heard from Caitlin Litton? No, she must be mad at me. And then I'll think, yeah, I told her no about something on Sunday and she's mad at me. Yeah. I don't care about making her mad no more, because I'm just not going to be a prisoner in my own home, in my own mind, in my own soul, to what she's got going on. It's hard. Whoever asked that question, it's hard, parents. It's so hard. And yeah, we screw up. We're screwing up all the time. But I just try to make sure that my screw ups are coming from a place of genuine love and concern and empathy. Like, if I can say charge it to my heart instead of my head, you know what I'm saying? Like, yeah, I screwed up out of love. I'm sorry.
Yeah, but that's the best way to screw up, isn't it?
I mean, that's all I got. I mean, I tried. I'm sorry. It wasn't the right thing. And then it's always, well, if you had done, well, so-and-so and so-and-so and so-and-so and so-and-so, and it all is your fault because of so-and-so and so-and-so. Yeah. No, it's your fault because you choosing to be out there doing what you're doing. I mean, we're going to take it all the way back to a couple years ago. If you was here, not out there with people that steal and lie and rob and do all the crazy things that y'all do to each other, you wouldn't be in this situation. And I don't have a problem putting it back on her. Ultimately, this that's happening to you out there is because you choose to not be here.
Because she has the option. She has a home.
Of course she's at home. I go get her. If she called me right now, I'd slam this computer down and go get her. Of course she's got a home. She's the one don't want to live here.
Okay, pivoting here a little bit. We've you've been working in harm reduction for a while, and this kind of niche, it's, you're immersed in it, but most of the world didn't know much of anything about harm reduction. But more recently, there's been a lot of discussion about crack pipes that were in the media, right? So someone's asked a question about that. They've said, I still don't understand, if you give away crack pipes, how that helps.
I didn't either. I did not either. That is the dumbest thing. Until I saw why it wasn't. And this is what I saw. Because I wasn't for it either. Now, listen here. Listen, I threw up in my trash can the first time I ordered this mess. Who does this? Mm-hmm. Let me tell you. So, I done told you about these raggedy arms and the needles and stuff. So, they inject cocaine. You can inject coke. So some people not know that, but you can inject cocaine. All right. I've never done it, but I understand that it is a euphoria like nobody's business. Okay. So that's fine, but it tears up the veins. It's very caustic. You have to break it down with the inject. It's just terrible. Don't do it. 0 out of 10. I do not recommend. So I said, a lot of crack here. So the cocaine here is no good. There's no cocaine here, but there's crack. Okay. Which is not that chemically different. All right. Mm-hmm. I'm like, well, if they got crack, instead of shooting this make-believe cocaine, I wonder what would happen. So I bought, they're called stems or straights. They're just pieces of glass. I had one in here somewhere. They're just pieces of glass. Just glass tubes, that alone. And you can do lots of things with them. People can smoke marijuana out of them. They're great for that. You can smoke crack out of them. You can do hot rails with meth. That's a whole nother thing. But anyway, I was like, look, I got these things. I got these pipes. I got this. What about I started having a lot of people saying, well, I mean, I can try it. I mean, I'll try it. And you're like, great. You just introduce them to something else is all you're doing, right? No. I have had so many people stop injecting. They've stopped sticking needles in their arms. And they've started smoking crack. They're not putting themselves at risk for these sores because I done told y'all the stuff they're injecting is so caustic. It burns so bad. My brother's so loud. It burns so. Be quiet. I'm on a darn live. Be quiet right there. Right there. I'm trying to tell these people about some stuff.
Tell him, he said.
Tell him, I'm sorry. My brother Brent. It's right there, baby. Welcome back. Brent. Just get the box and get out. Get the box. Get the box. Get out and go with what you got. Bye-bye. Thank you. Sorry. So take the dog. I left the dog. Okay, sorry, y'all. My life. They stopped injecting and they started smoking crack. No sores, no blisters on their arms, no bacterial endocarditis, no heart infections. They're not injecting, they're just smoking. Well, let me tell you, I had several of them that went from injecting to smoking. That finally was just like, no, my teeth are too nice, or I'm too pretty, or I'm really starting to see some physical changes, and I just don't think I want to do this anymore. I think I'm gonna put it down. I think about it like this. A lot of people quit smoking cigarettes by chewing that nicotine gum or wearing those nicotine patches, right? Mm-hmm. It's still the same chemical. It's the nicotine. Mm-hmm. It's a safer delivery system. And they use that until, well, or they use either right on forever, or they decide that, okay, it's not worth it anymore. I'm gonna put it down. Giving somebody a meth bowl to smoke meth, vaporize it. If they're going to use meth, they're going to use it. I'd rather them vaporize it than inject it. Because if they're injecting it, they're at increased risk for a drug poisoning. Because if we're injecting meth and we're not heating it first, you could still get fentanyl in it. Infections, skin infections, heart infections, MRSA, MRSA, VRE, vancomycin resistant enterococcus, all these things, HIV, Hep C. You're looking at people contracting diseases and illnesses that could cost hundreds of thousands of dollars over a lifetime to death. So that's the deal with the crack pipes.
Mm-hmm. Mm-hmm. And we have a question here that's asked about success stories. And I'm going to ask you that question, but it occurs to me, everything you've been describing thus far are success stories. Someone going from injecting drugs to using a pipe instead, using a stem or a straight, as you said, is an example of a success story. But what about other examples of success stories in your experience?
I got one for you. So this kid used to go to school with my baby. And this kid, he had the worst home life. And I was his mama for a long time. Since about third grade, they went to school together. About third grade, I picked this youngin' up at my house, eating my groceries, sleeping at my house. It was just another kid. I just, like if I could have got a social security number, I'd have just claimed him. He fell into substance use because his mama used, and they became kind of I hate that. I'm not gonna say that word, that code. I'm not gonna say that codependent. I don't really, but they kind of were though. Really, I mean, they fed off each other. They used it. One didn't think the other one was ever gonna live without the other one, and blah 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 blah. So go through this whole thing. He starts looking so bad. I guess everything fell apart for him about a year and a half ago. I just knew he was going to die. He looked like he had congestive heart failure. His feet and ankles are all swollen up. This kid's Kaylin's age now. His sweet little mama. She's so sick now. But this youngin come to me and said, "Mom, I don't want to do this no more. But I don't know where to go and what to do." And I said, "I bet we can find somewhere for you to go." And we could. I keep a male and a female bed on deck at all times. I'm ready. My baby messaged me last week. He's a year abstinent. He's in a new town. He's getting his GED. He's got an apartment, his own apartment for the first time ever in his life. He is an assistant manager at his job. He's been there so long and does so good. He says, when I got ready to change, had I not had a harm reductionist in my life, had I not had somebody to call that I knew had access to resources, could get me where I needed to go, that knew me, that knew kind of what was going to work for me and what wasn't going to work for me. Had I not had somebody in my life that could help me find those resources, but that also, if I had called in 2 months and said, "I've ran away from this place, screw this place, I'm coming back home," that you would have, that you're still going to be like, "All right, baby, let me know when you get here. Let me know when you get back in town. If you're going to go back to the life, let's make sure that you know that you can overdose and die tonight, okay? Let's do." He said that is what gave him the courage to go, because he knew he could not fail. That failure for him meant disappointing me. Failure for him meant that I might not love him. And he knew he could not fail with me. And that is what gave him the courage to go.
Well, that is a success story. My goodness. This seems like maybe a good place to kind of cap off what's been a really good conversation. So someone's asked, you know, we're quite a ways away from you up here in Lexington. How can we help? How can we help you and support your work from up here in Lexington? We just think you're a badass harm reductionist, and we want to support you. How can we do that?
I don't know. Like I said, I pay for everything out of my pocket. I got a Venmo. I got all that kind of crap. PayPal. I don't like asking for money though.
Can we put your Venmo out there? Just if people want to support the harm reduction work you're doing, is it okay?
I think Amanda has it.
Okay, yeah, put that out there.
I got a PayPal if y'all want that. I can message that to her. But that's and just try to think about if you hear somebody talking about we're enabling them with the crack pipes and we're doing this and we're doing that, just try to think about some of these stories that I've told y'all. These are not the exceptions. This is what me, one part, it's me and one volunteer, 1 5-hour-a-week volunteer. She only goes with me on outreach on Mondays. This is what one person with one vehicle and whatever supplies she can afford that week can do. I'm not out there giving people $1 million in gold coins and diamonds. I'm giving them friggin' condoms and crack pipes, for God's sake. But I'm giving them hope. And I'm giving them a connection. I'm giving them somebody that no matter what they do, they can't fail.
Yeah, and you're doing it out of your own pocket. So with your permission, I'm going to share that your Venmo is 229 Safer Living Access. If folks want to reach out and donate and support, that money's going to harm reduction supplies that are saving people's lives. That sounds like just the most important work that there is. Jessie, as we kind of conclude here, do you have a finishing thought, something that like words of wisdom you'd like to part with?
Yes. Get in. Sorry, my dog. No, just remember. Get up here. Get up here. Liam. I'm much firmer with my youngin than I am this stupid little dog. Just remember this. Every single junkie is somebody's son or daughter or mama or daddy or brother or sister. And that person, I promise you, did not wake up one morning and say, I know what I'm going to be for the rest of my life. I know what I'm going to do. They didn't. The substance use, for however it might have started for a physical pain. It might have started for an emotional pain. It might have started for fun. There's not a law against pleasure. It's okay to go out after work and have a drink with your buddies. It's okay to do these things. But if you have the genetic predisposition for substance use disorder, sometimes things get away from us a lot quicker than we think they can. It starts out innocent. There's always an underlying reason. And for people who are using substances to deal with trauma and pain, the substance use, that's just the Band-Aid on the hemorrhage. That's not the problem. So try to see everyone as the human that they are. We all have our addictions. We all have our vices. We all have our dependencies, whether we want to admit them or not. For some, it's Mountain Dews. For some, it's coffee. For some, it's heroin or meth or alcohol. Some are regulated and sold in a store, so that makes them not quite as scary. They're checked, they're regulated, they're taxed, they're safe. It's these things out here that we don't know about that people are getting into. Those are the ones that are getting us.
Well, Jessie B, thanks for spending an evening with us. And we had only spoken for like a brief 15 minutes, one brief conversation before this. So this was really awesome to get an opportunity to learn more about you and your story and your work. Thanks for sharing your heart and your experience. And I hope that folks at home learned as much about harm reduction as I did. And maybe we'll have you back again to learn more.
I would love to come back. If anybody wants to connect with me outside of here, y'all are welcome to put my email, my my Facebook link or whatever. I don't mind that at all. Absolutely not. Anybody can feel free to reach out to me with any questions. If I can help.
Let's go ahead and get that up there for you. What's your Facebook? Is that 247 Safer Living Access?
229.
229, sorry.
That's all right. 229 Safer Living Access. They can connect with me on my personal one. I don't care. I mean, it's not private. It's not private. Just Jessica Holton Blanchard. And then they can reach me at 229 Safer Living Access at gmail.com.
Gmail. Okay. All right. We'll be looking for your inbox to be flooded. I expect to get some interactions from the folks. All right.
Thank
Jessie.
y'all for having me. Thank you for listening. It's so important. Thank y'all.
Absolutely. Have a good night, Jessie. Thanks, everybody.
You too. Thanks. Bye.